Hello, good evening. Good evening, everyone. Can you hear me? Sorry, there's a problem on our live, so we have a problem with the live. That's why I have to change the output. Well, can you hear me? Yeah. I hope you can hear me. Let's just wait for a couple of minutes and then we'll make a start. Good evening, everyone. Just to make sure you can hear me, yeah. Can you type on the chat box if you can hear me, please? Let's just wait for a couple more people. Yeah. I hope you can hear me. I'm just having problems with my Wi-Fi. Good evening, everyone. I hope you can hear me. Can you hear me? Yeah. I don't know if you can hear me. Okay. Let's just wait for a couple more people and then we'll make a start. If you can probably put in the chat box which part of the UK you're from or which part of the world, that will be useful. Yep, you can hear me, Easter. Sorry. Sorry about the delay. Guys, request, yeah, please type which part of the world you're from so I know who's watching. Okay, so good evening. It's a Wednesday. Thank you for joining me on a Wednesday evening. I know it's raining, so please do subscribe on my channel. Yeah. Let's reach 100,000 very soon. Okay, so thank you for joining us. I know it's cold. Probably you had the long shift. Um, you're tired, but thank you for joining me this evening. We have at the moment Jarek. Jarek is from Colchester. Am I saying it properly? Joy, I'm just here. I'm just here to say thank you. Oh, you passed the OSCE. Well done. Thank you, Joy, for sharing that. That's very good. Congratulations. Congratulations on that. Okay. Congratulations, Joy. Thank you for sharing it. I do appreciate that. You passed last week in one sitting. Oh, well done. Well done. Okay, thank you for joining us. And hopefully the others will pass too. Um, Jericho, okay. Um, Congratulations. Oh, Easter, I remember you. When is your exam? I thought you had your exam already. So hopefully very soon, yeah. Congratulations everyone. We have how many? We have 10 million viewers now. Okay. So tonight as you can see on the description box, I know this not description box. As you can see on the title, we will be discussing I am. Okay, so we will be discussing I am today. Soon, okay. I just can't remember. I thought you had examination. So you're writing your anatomy. Good luck. I don't know what you mean by anatomy, but yeah, good luck. Good luck on your exams, yeah. Um so so for those people who will be watching this video in the future, thank you for joining us. I don't know if we have people from other parts of the world. So we will be starting shortly, yeah. So do me a favor, guys. So please do like this video if you can share this, or of course, please do subscribe on my channel. So and of course, turn the notification on so you'll know when we are going live. Okay. We just had some glitches this earlier. That's why I cannot go live for some reason. I think it's the rain. Okay, but sorry. But hopefully you will enjoy our session. We only have like an hour and a half or an hour long session, so please, hopefully you will learn something tonight. Yeah, it's a study with me session. I don't have any presentation and all. We will just study together. Okay, so tonight we'll be discussing I am. So I am, it's for adult nurses. I am is also for midwives. I am, we also have I am in mental health and learning disability. So I think also for nursing associates. So um yep, this is one of the stations wherein it's present um with all exams. Yeah. So hopefully you'll enjoy and learn something tonight. So probably this is my question. Have you tried giving IM injection in your life? Probably, yeah. Probably all of us we've given IM injection at some point in our lives. Um, Precious. Sorry, I cannot. I don't know how to say your full name, but thank you for joining us, Precious, this evening. Yep. I know it's very cold outside and it's raining here in the UK. Hopefully you'll stay with me. Yeah. So I can see we have more people joining us. If you type something on the chat box, I will call your name. So let's do some shout out, yeah, as we go along. So going back to what I was saying, so probably all of us we've experienced giving IM injection at some point in our lives, probably as a student or probably once we registered. So definitely this is one of the easier skills in the OSCE because we experience giving IM, okay? But we will discuss, of course, the NMC standard. Hello, Emmer. Hi, Nins. Which part of the UK you're from, or which part of the world, if you're not here in the UK yet? So at the moment, what's the time now? The time in the UK is 17 past 8. Okay, so it will be bedtime soon for most of us. Okay. Hopefully no one's working at this very moment. Yeah, any night shift people who's listening. Hopefully you can hear me properly. Yeah, because I don't know if you can hear me. Okay. All right, we will make a start. Again, thank you for joining us. Please do follow me in my social media accounts. It's on the screen. And yeah, please do like this video, share this, and of course subscribe to my channel. Okay, we will reach 1 million subscribers very soon. Okay, all right. Thank you. Kemi from Scotland. Okay, there you go. I think a lot of people are actually joining it from Scotland. Okay, from Edinburgh. Am I saying it properly? Paisley, Scotland. I don't know. I've never been there. I've been to Edinburgh and Glasgow. Elizabeth. I remember Elizabeth. Elizabeth, have you been here before in one of our um live streams? Sorry if I don't remember you guys, yeah. Because I think I've met a lot of Elizabeth before, so I'm not sure if you're the same person. But yeah, thank you for joining us. Um okay, thank you for joining us. I can see some people joining us. All right, we will make a start. Yeah, okay, Elizabeth. Thank you for joining us again. Okay, so hopefully Irish, hi Irish. Thank you for joining us this evening. Okay, we will make a start. So please do like this video. Please do follow me on my social media, and of course, do subscribe on my YouTube channel. We had some glitches earlier. I'm really sorry. That's why we had a late start. But you're okay, yeah. We are all staying until 1 o'clock, yeah. So we will be discussing IM until 1 o'clock in the morning. So hopefully you can stay with me, yeah. No one's gonna sleep. All right. Okay. So we will now start with the IM. So IM or intramuscular injection. I'll just give you some not background, but I mean since the start of the OSCE, IM is there, yeah. Um, since the OSCE was created, IM is always there from the very beginning. Yeah, there are a couple of changes over time. So the one I'm going to discuss tonight, it's the latest marking criteria. Okay, so I always say this during my class to please before you go to your exam, make sure you check the marking criteria. Jared. Jared. Is it Jared Paul? Thank you for joining me. Jared, congratulations, Jared. If you're Jared, yeah. Congratulations for your promotion. Well done. So yeah, we will now discuss. Sorry, I keep looking at on the comment section. All right. So we will now make a start. Sorry, my eyes are bad, but okay. So the one on your screen, it's the marking. Congratulations, Jared. Yeah. So well done. Um. Okay. Let me just move it. All right. There you go. It's moving. Well done. So the one on the screen is the latest marking criteria. Oh, I'm just appreciating my lighting at the back. Yeah. Can you not appreciate my lighting at the back? So let's go to page. So the one I'm showing on the screen is marking criteria version. What's the version? I cannot read it. What version 2? Where's my glasses? Well, I cannot read it. There you go. It's version 2.1. It was updated the 23rd of the 6th, 2023. If you're wondering where did I get this marking criteria from, so if you go to Google, search for OSCE supporting documents. If you type Oxford Brookes or Northampton, Northumbria, Leeds, Ulster, you should have the same marking criteria. So again, the one I'm going to discuss tonight, it's version 2.1, 23rd of the 6th, 2023 updated. Yeah, again, if you're watching this video in the future, in 3000, year 3000, probably this is no longer applicable. Okay, so let's go to page 25, I think. All right. So if you go to page 25, so for those people who's got a copy of this, so please grab it and let's turn to page 25. All right. Is it page 25? There you go, page 25. So we will discuss this tonight. I hope you can see it, yeah? If it's too small, just grab your own copy. Okay. So the first criteria here is to introduce yourself, explain the procedure, and gain consent. Okay. So let me ask you guys, how would you introduce yourself for IM? Okay, and how would you explain the procedure, and what will you say to gain consent? Okay, so that's our drill. Okay, that's our activity tonight. Help me. So if you can type it on the chat box, how would you introduce yourself? How would you explain the procedure, and how would you gain consent? So help me, yeah. Let's try and brainstorm what is our best script or best way of introducing ourselves. Yeah. So if you can type your answers on the comment section or on the chat box, and then we will read it together. Okay. So we need some of your brains tonight. Okay. Whilst waiting for your answer, let's just listen to some music. Any guesses? Okay, type it on the chat box, yeah? I'll wait for your answers. Come on. No answers? Elizabeth, I can see her answer. Any other answers from the crowd? All right. So Elizabeth said, "Hi, I am Beth, and I will be your nurse for today." So my question is, how would you introduce yourself, and how would you explain this skill I am to the patient, and how would you gain consent? Yeah, help me. Let's try and brainstorm tonight. Yeah. So Elizabeth said, "Hi, I'm Beth. Beth, I will be your nurse for today, and I'm here to." I think you're still typing. Shall we move on? Yeah. So where's the chat? Thank you. All right. Answer. So, of course, introduce yourself. What's your role? Probably, I am your nurse for today, and explain the procedure. I'm here to administer your intramuscular injection, and of of course, gain consent. Um, are you happy to proceed, or will that be all right? Okay, so let's read some answers. Nins, she said, "Hello, I'm Nina. I will be your nurse today. I'm here to give you intramuscular injection. The medication will be vitamin B12." Okay, so Nins know the medication in advance. Okay, well done. So, Kemi, hello, I'm Kemi, one of your nurses. Today, I will be administering your medication, your due medication. Before that, can you please confirm your name, date of birth? Well done. Joanna said, "Hello, good afternoon. I am Joanna, your nurse for today. I'm here to give you your intramuscular injection, which is your hydroxycobalamin or vitamin B12. Is that all right?" So well done. Thank you for your answers. Yeah, keep answering. Um, and then for those people, I can see we have 2 million watchers now. Yeah, so if you're shy to type your answers, try to answer silently. I mean, not silently. Try to answer on your own. Yeah, if you're on your own room, try to answer. Yeah, so let's study together. Okay, so this is, if this is your first time joining me, this is how we do it. So we study together. Okay. Um, so thank you for those people who gave their answers. Well done. Of course, well done. Okay. So before I proceed to the next criteria, I have a question. Emmer, during our practice, oh, I've seen, I mean, a lot of videos online that I mean, nurses who perform this, they've started with Cinesafe. What else? Privacy and dignity. What else? Um, those stuff. Okay, so can you see that on the marking criteria? Can you see any Cinesafe? Can you see any, what do you call this? Cinesafe, privacy and dignity written on the marking criteria? Is it written? Kemi said, "Any allergies and reactions, I will talk about the class of drug and side effects. Are you happy for me to proceed?" Well done, Kemi. Okay, but before that, that's my question. Can you see any? Joanna said no. Okay. But Emmer, question. Because during our training, during our practice, and of course, based on your videos, okay, based on a lot of videos on YouTube, everyone was starting with CineSafe, provide privacy and dignity, etc. Can I do that on the exam? Okay, of course you can do it. Yeah, of course you can do it. So before you start the station, if you want to start with CineSafe, provide privacy and yeah, CineSafe. There are no fall hazards, no water spillage. I will provide privacy and dignity to my patient. I will close the curtain. All those stuff. If you want to, what you call this? If you want to say that, why not? Okay, why not? But just being objective, that is not part of the marking criteria. Okay, being objective is not part of the marking criteria. That means you will still pass without saying that. Okay, or without doing it. Again, you will still pass without doing it. But of course, I do recommend, why not just say it? Okay. Um, why not just say it? Okay, so before you start, um, simply tell your patient or the assessor that the scene is safe. There are no fall hazards, no spillage, or anything that might cause an accident. All right, so why not? And of course, you inform the assessor or the patient that you will provide dignity. Some people, they say, "I will close the curtain, I will close the door," etc. Okay, so that might be your opening um, script before you start. But again, I think I've mentioned this in the previous what do you call this, previous sessions. Avoid avoid creating script, yeah. Okay, but again, we cannot help that. We cannot help it, because of course, for most of us, English might not be our first language. Okay, so we really need to create or formulate a script. Okay, which is fine. Definitely, I do understand that. But based on the materials from the test center, they said avoid being very scripted on the exam, based on the website. Yeah. All right. All right. That is our first um first few criteria. So number two, according to the marking criteria, we have before administering any prescribed drug, including oxygen, looks at the person's prescription, chart and correctly verbalizes all of the following checks. So the person check the ID with person, verbally against wristband where appropriate, and documentation. Of course, you have to check the drug, the dose, the date, and the time of administration. The route, the method of administration, the diluent, if appropriate, and allergies. Okay, so definitely before you start, I saw some answers. They said, um, before you start, you have to identify that you have the correct patient. So if you're in the hospital, we expect to see an ID band. Okay, so during the examination, if you're in the hospital, expect to see an ID band. But this particular scenario, the skill in particular on the exam, it's in the community. Okay, so it's a community scenario. This IM station, or this IM, it's in the community. So um, you are not expecting to see ID bands. Okay, because at home, when you're sleeping, you don't normally wear ID bands. Okay, so what are the possible community scenarios that you might see this medication? Probably number one, or give me some ideas. Okay, so um, where do you think the administration of IM will take place on the exam? Okay, give me some answers. Yeah, where do you think the administration of intramuscular injection would take place on the actual examination? Okay, you have a couple of choices, but if you can give me some guesses, where do you think this would take place? Let's just analyze the entire scenario, yeah? So put your answers on the chat box. So whilst you're putting your answer, good evening everyone. Thank you for joining me. If you're new to the channel, please do subscribe, and please do follow me on my social media accounts. We normally do our live stream every Wednesday, so every 8 o'clock. So hopefully, you will join me in the next few every week. Okay, every week. Okay, so my original question, I can see some answers now on the screen. My original question was, or is, where do you think this particular skill would take place on the exam? So I did mention, I gave a hint, it's in the community, it's not in the hospital. Okay, it's in the community. So can you give me a wild guess, where do you think this would take place? So some answers, Easter said care home. Okay, why not? Definitely. So on the exams, yeah, care home is part of the community. Okay, so it's part of the community. So well done. Nins said hospital, not in the hospital, Nins. Yeah, not this one. Namrata, she said GP, well done. That's also a nice guess. Yeah, because of course GP is part of primary care. It's in the community, definitely. All right. So I cannot see the correct answer. Okay. Any other guesses? Any other community scenario that you think, or community setting, that this would take place? There's one missing on your answer. It might be It might take place at the patient's. No guesses? It would take place at the patient's home. Well done. Okay, well done, Nins. Okay, so it might take place at the patient's residence. Okay, so well done, well done. At home. Okay, so that means you are one of the possibly community nurse. Yeah, one of the community nurses. Probably that's your role. Okay, during this scenario. Well done. Okay, so I can see Nanette said house, Rosel house, Nins, yeah, patient's home. Well done. So that means you are acting, or probably your role is a community nurse during this station. Well done. All right. So hopefully we have some we trying to analyze the scenario now. Okay, so well done. So that's it. All right. Well done, Nanette. All right. So well done. So before we carry on, I will just quickly show you the prescription. Okay. Oh, not the prescription. Let's start first with my question is, okay, so I know some of you mentioned this already on your comments, but what medication do you think we will administer during this station? So I did mention that ever since the creation of the OSCE, they've never changed the medication. It's the same medication up until now. But of course, you'll never know. They might change it on Monday, okay? They might change it on Monday, but if you could comment, what do you think is the medication we're going to administer, and what is the medication for? Then we will study the medication in a bit, yeah? So what do you think is the medication, and what is the medication for? Hi, Easter said hydroxycobalamin. Nin said it's vitamin B12, so well done. Well done, everyone. Next question. Easter said anemia. Any other comments? What is this medication for? Thank you for those people still watching, yeah? We will be here until 1 o'clock in the morning. Okay. So, what is the indication? Well done. Your answers are correct. What is the indication for vitamin B12 for hydroxycobalamin? So I can see your answers. Anemia for vitamin B deficiency. Okay. Well then, so the answer is vitamin B12. All right. Kemi, I think for pernicious anemia. Okay. All right. So I will now show on the screen. We will see together. Okay. So we will see together. So but thank you for all your answers. You're still awake. Okay. We will find out the answer together. So at least you will remember this on the day of the exams. Okay. So Namrata said for vitamin B12 deficiency. Well done. Let me show it on the screen. So if you've attended the previous sessions, you know that we will be using the BNF as our main resource for medication. Okay, so let's see. All right. On the screen, I don't know if you can see it now. On the screen, you can see the BNF website, yeah, under the NICE guidelines. So we will discuss what hydroxycobalamin is. I hope you can see it, yeah. If you're using your phones, probably you cannot see it properly, but let's see. Okay, all right. So you did mention, let's see. Let's check the indication. So during this station, you will also be given the opportunity to use the BNF. Okay, you'll be given the opportunity to use the BNF using a tablet or the iPad. If they have an iPad during the exam, it might be just an Android tablet you will be using on the day. Yeah. If in case you don't know what vitamin B12 is, you can It's not clear. Don't worry. I will move it. It's not very clear. Yeah? It's not too big. Let's make it bigger. Let's make it bigger so you can see it. Bear with me. Let's make it bigger. Oops, where's my face now? Okay. Ta-da! All right. My face is covered now. Let's make it a bit small. Okay. All right. There you go. I hope you can read it better, yeah? So let's see. Okay, let's see. All right. Let's go to indication. All right. So, based here, as you can see on the screen, it's a prophylaxis for microcytic anemia associated with vitamin B12 deficiency. Well done. So, it's for pernicious anemia and other microcytic anemias without neurological involvement. Okay, well done. Okay, so all your answers are correct. Question before we proceed to the next one. Okay, what's the normal preparation? Okay, how do we normally give this? Okay, what's the dose when you're giving vitamin B12? Okay, what's the dose? You can no longer see my face, but what's the dose? Okay, I don't know if you can see it on the screen, but what's the normal dose when we give vitamin B12? If you can type it on the chat box. And how often? Okay, let's see if you can read it. Because of course, once we know it, probably that's the same prescription on the examination. What do you think? Nin said it's 1 milligram every 2 to 3 months. Well done. Okay, so well done. It says here, actually it's on the screen. If you're giving it intramuscularly, it should be 1 milligram every 2 to 3 months. Okay, based on the BNF. Okay, so if you're giving it as a prophylaxis. Okay. Well done. Every 3 months. Well done, Easter. So probably on the day of the examination, well done, Jeffrey and CC. Well done. I love your names. Okay, because sorry, my face is now being covered. Let's move. I'll move. Okay. All right. Question. There's another use for hydroxycobalamin. Yeah, there's another use for hydroxycobalamin. This is an antidote for what? Okay, if you can answer me. All right. So this is just a trivia. Yeah, just a trivia. It's not part of the examination, but if you can answer me, this hydroxycobalamin is an antidote for what? Okay. Let's see. Yeah, let's use our brains. If you can still remember, hydroxycobalamin or vitamin B12 is an antidote for what? Okay. Hopefully, I will be able to impart this very nice information. Okay. Let's write your guess on the chat box. Okay, write your guess. Hydroxycobalamin is an antidote for what? Okay. Let's see if any one of you can answer this question. Yep, Easter, for poisoning of what? Okay. Oh, Sakura, alcohol intoxication. No googling, yeah, no googling. So write your best guess on the comment section. Okay. So hydroxycobalamin is an antidote for what poisoning? What type of poisoning? You are nearly there. Well done, Naneth. Okay. So according to Naneth, hydroxycobalamin is an antidote for cyanide poisoning. So well done. Okay, well done. That's very good. Okay, that's the answer I'm looking for. Actually, if you check, if you check this, the one on the screen, it actually is actually written there. Okay. Um, for some reason, it's not allowing me to scroll down, but here, there you go. There you go. It's on the screen. It's an antidote for cyanide poisoning as well. So apart from giving this for people with pernicious anemia, or a prophylaxis for people with pernicious anemia or with vitamin B12 deficiency, it is also an antidote for cyanide poisoning. So well done. Okay. So my next question, what are the common side effects, okay, when giving vitamin B12? Okay, what are the common side effects? If you can give me some side effects. I hope you're enjoying our session, yeah? I hope you're enjoying. I would like our session to be as interactive as possible. I'm really sorry I cannot hear your voice because we're using YouTube Live today. I know during our PNA sessions, if you remember if you remember that, we're using a different software, but we're using YouTube Live, so I cannot hear your voices, unfortunately. Okay, so guys, if you can type on the comment section, what do you think are the common side effects of vitamin B12? Neneth said, purplish to reddish discoloration. Do you agree with Neneth or any other answers? We will find out shortly. Yeah, we'll find out shortly. I'm just showing it on the screen so we have reference, okay? So we have reference. We will find out together. Okay, so on the examination, you are very sure what to say to your patient and to your assessor, okay? Namrata said nausea, vomiting, dizziness. Joanna said nausea. Thank you for answers. Any other answers? We will find out shortly, but yeah, thank you for sharing your answers. Joanna said added vomiting. Well done. Let's see. Okay. For those people who's watching and very shy of answering, think of your answer before we show on the screen. Okay. All right. Let's go to the side effects. I don't know if you can see it. I'm really sorry. The setting of our presentation is kind of off tonight. Let's make it bigger. There you go. You can see it. You can see my face. All right. Jeffrey said diarrhea. All right. There you go. It's in front of my face now. Okay. Let's check the side effects of hydroxycobalamin. All right. As you can see in front of me on the screen, the general side effects are the following. I don't know if you can read it. It says here, general side effects are diarrhea. So well done for those people who answered diarrhea. Well done. Okay. Dizziness. Well done. I think some people answered dizziness, so that's very good. Hot flush. There you go. Hot flush. Nausea, skin reactions, and urine discoloration. There you go. Those are the general side effects when receiving or when taking or when administering vitamin B12. Okay, so well done for those people who got it correctly. Give yourself a pat on the back. Well done. Okay, let's have some let's see, specific side effects. There you go. Specific side effects. So arrhythmia, chills, drug fever, hypokalemia. It says here with intramuscular use, pain, tremors, and vomiting. Okay, so those are the common side effects if you're giving it intramuscularly. So I don't know if you can read it properly on the screen, but if you go to BNF, on the BNF website, you can see all this. Yeah, you can see all this. So I hope you learned something tonight in terms of regarding vitamin B12. Okay, so any questions? So those are the things that you might be mentioning to your patient on the day of the examination. So let's recap. Okay, let's try to recap what we learned about vitamin B12. Let me just move it out of my face. Okay, so let's make it smaller. All right, there you go. So let's recap what we learned from the BNF. Okay, so let's recap. So vitamin B12, what you've mentioned, everybody mentioned this. So vitamin B12 is for pernicious anemia, for vitamin B12 deficiency. Okay, it can be given intramuscularly 1 milligram every 2 to 3 months. Okay, so it also good to note that vitamin B12 is an antidote for cyanide poisoning. You don't have to mention that on the examination, but nice to know. Okay, general side effects. So your answers are all correct. You did say the general side effects would be, what did we say? I can't remember now. Diarrhea, dizziness, headache, hot flush, nausea, skin reaction, and urine discoloration. Okay, so well done. Thank you for all your answers. Okay, so before we proceed, I will quickly show you how the prescription would look like. Okay, before we proceed, let me just quickly show you how the prescription would look like. All right, the one on the screen, this one, this one, yeah, this one. it's the prescription that you will see, an example of a prescription that you will see on the examination. Yeah. So Emmer, but it says here administration of inhaled medication. Is that the same? So because I cannot find my copy, yeah, but it's the same. It should look the same as this one, the one on your screen. Yeah, it should look the same. It says here administration of inhaled medication. So instead of inhaled medication, you will see administration of intramuscular injection. So it will be the same. So during this exam, you will see a scenario written, and then this will be the prescription. So of course, excluding, sorry, I cannot read it properly. My eyes are really bad. Okay. All right. So this is, sorry, I cannot read it. I hope you can read it. Yeah. So this is the example of the prescription. This is how the prescription would look like during the examination. So you can see on the left-hand side of the screen, you will see the patient's details, the name, the date of birth, NHS number. You will see allergies. You will also see the medication prescribed. So most likely it's vitamin B12 or hydroxycobalamin. The dose, of course, it might be 1 milligram every 2 to 3 months. Okay, and that day, on the day of the examination, might be your first time giving it, or probably it's after 3 months after the first dose. Okay, so that might be the scenario during the examination. And what do you need to do on the examination? So you just need to sign it. Okay, you need to sign it. So you have to put your name, the date, the signature. Okay, so whatever is written on your actual paper on the day. So it is important you complete your documentation on the day. Okay, before we go back to the marking criteria, I hope you have it. Do you have any questions so far? So before we go to the marking criteria, I will now quickly show you the equipment. Okay, so what will be the equipment that you might, anticipate or expect to see on the day of the examination? Okay, so let's have a look. Okay, the one on the screen, I hope, I don't know if you've seen this before. This document, the one on your screen, this document is the equipment, yeah? The one on the screen is the equipment. All right. So let me just quickly show you. All right. If you haven't seen this, you have to, again, go to the test center's marking criteria. So if you type OSCE support, you type Oxford Brookes, Leeds, Northumbria, Ulster, you should be able to see this document, okay? So this document contains the pictures or the equipment that you might see on the day. So if you haven't seen this, please go to the website, yeah? But if you've seen this before, it's then good for you that you've seen it before. But for those people who haven't seen this one, so this is the document which show you how the equipment would look like. Again, of course, on the day of the examination, it might be different, but it would be, I mean, kind of the same because it depends on the manufacturer, or it depends on what's the available on the day of the exam. So as you can see, definitely apron. We need apron on the day, of course, because you are preparing medication and you will be administering the medication. Definitely you need your apron. What else? What possible equipment that you might see on the day? The clinical waste bin. Of course, you will be discarding your medication. I mean, not with your medication. You will be discarding any clinical waste on this bin. Okay, so we have the yellow and the black bin during the day of the exam. So any clinical waste should go to the yellow bin. Okay. Question. I have a question for everybody. So, where will you discard the barrel of the syringe? Okay. Where will you discard the barrel of the syringe? Is it A, the clinical waste bin, B, the black bin, or C, the sharps bin? What's our answer? If you can type your answers on the chat box. Where are we going to discard the barrel of the syringe? So when we say the barrel of the syringe, the body, okay, without the needle. So where are you going to discard it? Yellow, black, or sharps? Sharps. Okay. You said sharp, you said yellow. No one's saying black, okay? No one's answering black. So, let me ask you guys, okay? I have a pen here. Okay. Let's say this is the barrel of the syringe, okay? The barrel. Again, a barrel is without the needle. Do you consider this a sharp object? Okay, do you consider this a sharp object or just a pointed object? Okay, imagine the one I'm holding is the barrel of the syringe. Okay, so where will you discard this? Yellow, black, or sharps? Okay, so black. Okay, so let's try and rule out, not rule out, reduce the answers. Okay, black bin, definitely not black bin. Why? Because of course it's not a domestic waste, so definitely syringes, aprons, those are considered as clinical wastes. Yeah, clinical waste. So we are now down to two options. It's either the yellow or the sharps bin. Okay, so this object, imagine this is the barrel of the syringe. We do not consider this as sharps. This is only a pointed object. That means if you are detaching the needle from the barrel will only be a clinical waste object. Okay? Again, if you are detaching the needle from the barrel will go to the yellow bin. The needle will go to the sharps bin. Okay? So, Emmer, what if I will not remove the needle from the barrel? Okay? Where will you discard this? Again, what if I don't remove the needle from the barrel? So where will you discard this? Black, yellow sharps. What's our answer? So if you won't remove the needle from the barrel, where will you discard it? What's our answer? Well done. Well done. So thank you for your answers. So Nanette said, if you will not detach the needle from the barrel, it will go to the sharps bin. Okay, so well done. Are we clear with that? Okay, so again, to recap what I said, if it's just the barrel of the syringe, the barrel will go to the yellow bin. Okay, the needle will go to the sharps bin. Okay, but if you don't detach, or if you won't detach the needle from the barrel, everything will go to the sharps bin. Okay, I hope that's clear. Okay, so I hope that's clear. Just be mindful where you're going, where you are discarding your equipment on the day of the examination, because of course it might cause fail. Okay, it might cause fail. So Emmer, you said the barrel. So I have a question. How about the posiflash? Okay, I know we're discussing IM, but how about the posiflash? Remember, for your VIP, for your intravenous intravenous medication, remember you are going to get to use a posiflash containing 0.9% sodium chloride. Okay, so where do you think you will discard the posiflash or the pre-filled syringe? Is it sharps or yellow? Yellow bin, rather. Easter, that's a good question. So will it be all right if you don't touch the barrel and throw it in the sharps bin? We are discussing this because we will discuss the marking card. It's what they call this. This information is very important when we go back to the marking criteria. Okay, later we will know. We will find out why am I stressing this information. Okay, so well done. Thank you. Your answers are clinical waste bin. Of course, the posiflush will go to the yellow bin because the posiflush is not a sharp object. Okay, it's a pointed object but not a sharp one. Yeah, so it's not sharp. Okay, so posiflush will go to the yellow bin, not the sharps bin. Okay, so again, unless there is a needle. All right, I hope that's clear. Okay, I hope you learned something tonight. If that's your first time hearing this information. Okay, let's continue. So the domestic waste bin is colored black, not yellow, black. Okay, so what are those? Probably your paper, your pen. It might go there. So if you're in doubt, of course, throw it on the clinical waste bin. What are the possible equipment that you might be throwing there? Of course, your gloves, your apron, okay, your gauze, your plaster. Okay, so any clinical waste, it should go on the yellow bin. Okay. All right. So of course you will be using the hand sanitizer during this station. You will be using gloves. What else are we using? Of course, definitely you will be using the sharps bin. Okay. Quick question. When we are preparing equipment, what do we need to check? Okay, that's my question. Before we, when we are preparing equipment, what are the things we have to consider or we have to check? We have to check. Okay, that's the question. Okay, when we are preparing equipment, what are the things do we need to check or we have to consider? If you can type it on the chat box. Expiration date. Well done, Easter. Well done. Then it said dry, intact, expiration date. Well done. Well done. Thank you for your answers. Okay, thank you for your answers. So whenever you prepare equipment for any stations, make sure to check if the equipment is clean, it's dry, it's intact. Okay, so make sure to check that expiration date, of course, definitely. Thank you for your answers. Okay, again, if it's clean, the intact, dry, expiration date. Okay, so basically checking the integrity of the packaging. Okay, of course, it's expired. You can no longer give it or use it. Okay, so definitely it is important. Okay, so take note of that when you're preparing your equipment during the exam. Next question. How about for the sharps bin? Okay, how about for the sharps bin? What is the most important information or thing that you have to consider or check when you are preparing or before you grab your sharps bin or sharps container? Okay, what is the most important question information or consideration you have to remember when you are using your sharps bin? Let's see. I hope you're enjoying our session. Yeah. Our session is normally just chill. Okay, we are all learning together. So thank you for answering and thank you for contributing um tonight. Okay? I hope you're enjoying it. All right. So again, going back to the question, what is the important consideration when you are preparing your or when you are getting your sharps container? Any thoughts? So Neneth said, completely labeled and signed, closed lid with upper lid partially open. Well done. That's very good, Neneth. Any other answers? Well done. Not 3/4 full. Okay. Well done. Very good, Neneth. So Neneth actually answered the question. Okay. So the most important information when you are preparing your sharps bin, make sure I don't know if you can see this on the screen, but typically sharps bin or sharps container, there is a line that would indicate if you can no longer use it. Okay, there is a line saying do not go above this line. Okay, that means it's 3/4 full. So well done, Nenet said that. Okay, so because again, if you fill the sharps bin, what will happen? There is a chance of needle stick injury. Okay, of course, if you're in practice, if your sharps container is full or the contents of your sharps bin is beyond the line, beyond the marking, of course, close it. Okay, close it and label it, and of course discard it properly. Okay, in real life. All right, so since you said half full, expired days leave close. Okay, so normally for the sharps bin, if you haven't seen one, we normally partially close it. Okay, partially close. We don't close it totally because if you haven't seen a sharps bin before, if you close the sharps bin, you can no longer open it. Okay, once you close the lid of the sharps bin, it will close forever. Okay, you can no longer open it. Okay, of course for safety reasons. So to summarize, the important information you have to consider when preparing your sharps bin, it should be, of course, intact. Definitely, you don't have to say it, but again, of course, the contents is not beyond the line. Probably like 3/4 full, and of course, it's partially closed. Okay, not closed because you can no longer open it. Okay, so that's the most important thing you have to consider. All right, next, let's see, let's see, let's see. So on the exam, you will see the injection pad. Okay, during the examination, you will see the injection pad, which means you will be giving the IM injection on the injection pad. Okay, so normally the injection pad is attached to the mannequin. Okay, during the exam, normally the injection pad is attached to the mannequin. So you will be giving it, normally it's placed on the patient's arms. Okay, normally it's placed here. Okay, either left or right. Okay, so important thing to take note of during the examination. So you will see the pad, the injection pad. Next, what else? What else? What other equipment do you think we will see? So this is the normal setup during the exam. If you haven't seen this document, please do check this document, yeah? Because this will be helpful. At least you would know in advance how the equipment would look like. What else do we need for IM injection? So this is the tablet, okay? During the examination, I did mention that you will have the opportunity to use the BNF or the iPad or the Android tablet in case you don't know what vitamin B12 is. But I guess earlier we discussed what vitamin B12, so hopefully that's useful in case you will be doing IM during the examination. Yeah. So Emmer, question: is it mandatory to use BNF? Okay. Again, is it mandatory to use the BNF? Let me ask you this question: do you think you will pass or you will fail if you don't use the BNF? Is it required? Or what if Emmer, I know vitamin B12 because I've attended your live session. Do I still need to use the BNF? Is that a requirement? What do we think? Or it's not a requirement? What do we think? Do you think you will pass without using the BNF as long as you know what vitamin B12 is? Or you will fail? What do we know? Nanette said no. You will still pass without. Is that your answer, Nanette? Yeah, you will still pass without using the BNF. So yeah, that's correct, Nanette. So during the examination, if you are confident enough what vitamin B12 is, it's not required. Yeah, remember this, using the BNF is not required during the examination. It's also applicable for other stations, such as implementation stations. Okay, remember this, using the BNF is not required. Okay, as long as you know what the medication you're about to give. Okay, that's the most important thing. As long as you're confident enough, you know what the medication you're about to administer, checking the BNF is not required. Okay, so please remember that. Why? It's not on the marking criteria. Okay, later we will go back to the marking criteria. It doesn't say there that you have to check the BNF. Okay, because of course in real life, probably how many medications do you know in real life? Probably at least like more than 20, more than 30, more than 50 medications. If you're confident what paracetamol is, of course, just give it. Okay, as long as you're confident, okay, you know what paracetamol is. Same goes with vitamin B12. Okay, if you're confident enough what this medication is, no need to check the BNF. Okay, because why? What will happen? You will lose a lot of time. Okay, you will lose a lot of time. Okay, that might result to a fail. Remember, if you run out of time, that might result to a fail. So if you know what vitamin B12 is, no need. Okay, so well done. Thank you for your answers. What else do we need on the day for vitamin? Let's have a look. I think we're nearly done with this document. Let's see, what else are we missing? Let's see. What else? Of course, the airstrip or the airstrip washproof plaster. Or is that what we call it? Okay. We normally just call it plaster, okay? The band-aid. There you go, the band-aid. If you go to the Philippines, we call this um band-aid. Okay. Whatever the brand is, band-aid. So the plaster on the screen, you will see this. There are reports from other people who took the examination. They said that they did not see any plaster. So what they saw instead, gauze and tape. Okay. During the examination, they only used a gauze because they did not see a plaster. So if you see plaster on the day of the exam, then that's good. Use it. If you don't see it, use the gauze instead to stop the bleeding. Okay. So next, of course, your swab. Okay, of course your swab. We'll be using swab during to clean the site. Later we'll talk about it. What else? What other equipment do we're gonna see? So insulin vial is for your subcut. What else? What other equipment are we going to see? This three equipment, okay? You will see this on the day of the examination. All right. So then it said blunt needle, injection needle with safety activator. Okay. Have you all seen these types of needle? Okay. So the filter needle, the fill needle. Okay. Let me ask you guys. Okay. I have a question. Why do we use a filter needle? What is the filter needle for? Or why do we use this red needle? What is the purpose? What do we think? What is the purpose of the red needle? Let's see. What are your answers? So while waiting for answers again, if this is your first time joining us, um, welcome. I know it's raining outside. It's cold. It's probably bedtime for some of you. Thank you for staying with me. Yes, please do like this stream. Share this screen. So of course, please do subscribe. Then it said for medication preparation. Um, that's correct. Definitely. Any other reasons why we're using the red needle? I was about to say the answer. Um, why do we use the red needle? What's special using this needle? What's special here? So we will be using, well done, used to withdraw medication in ampoule or vial. Well done. Okay. So there are two types, just so you know, guys. Yeah, there are two types of aspirating needle. We call them aspirating needle. Okay. So during the examination, I think you will be using the red filter needle. But in reality, there are two types. Yeah. One is the red one, and one is like the red and violet. Okay. The red and violet, we normally use it for when you're aspirating medication from a glass because it contains a filter. Okay? It contains a filter. Normally, the red fill needle, we use this when aspirating needle medication from a vial because we cannot use the violet one because the medication won't come out. Okay? um the red one, it doesn't have any filter. Yeah, so you're using that because of course you are not actually getting the medication from a glass ampule. Okay, you will be getting the medication from a plastic ampule, so definitely there are no glass to filter. Okay, so that's your, there you go, well done. So Curzon said there is like the red and the purple. Is it purple or like violet? So yeah, so in real life, yeah, in real life, the purple or the violet, it contains a filter to filter the glass. The red, it doesn't contain a filter, but we use it to of course, to aspirate the medication. Because if you put the filter on a red blunt needle, you won't be able to get the medication because of the rubber, okay, from the vial. Okay, so but during the examination, you will only see the red needle. Okay, so we use the red needle for aspirating the medication. Okay, so hopefully that's clear. Well done, I can see your answer. So in here on the screen, you can see the green and the blue. So question, it says here green is 21, the gauge 21, and then blue is gauge 23. Question, the higher the number, is it the bigger, or the lower the number, the bigger? What do we think in terms of gauges? Okay, in terms of gauge size, the higher the number, is it bigger or smaller? What do we think? So in terms of the needle, again, the higher the number, is it the size of the needle increases, or it's smaller? What do we think? Let's wait for your answers. So Nenit said the lower the number, the bigger. Do we agree with Nenit? What do we think? The lower the number, is it bigger or smaller? What do you think? Do we agree with Nanette? Easter said the higher, the smaller gauge. The lower the number, the bigger. Jeffrey said. Okay. So thank you for your answers. Okay. So to summarize, the lower the number. So if we compare 21 and 23, the lower the number, the bigger the needle is. Okay? That means 23 is smaller than 21. Okay? The lower the number, the bigger. Okay? The lower the number, the bigger. For needles. Okay? For needles. Okay. I will show you another photo to prove my point. Okay? If you don't agree, I will show you another photo. This one. Okay? The one on your screen, can you see the orange one? So the orange one or the pink one, it's gauge 25. Okay, it's gauge 25. So we use this for subcut. That means it's smaller. Okay, so again, to summarize, the lower the number, the bigger, the higher the number, the smaller. Okay, so during the exam, if you're gonna use 21 or 23, that's correct, both correct. But of course, do not use gauge 25 because gauge 25 is intended for subcutaneous injection. Okay, but again, that's for another topic. But you will not be using gauge 25 during the examination because you are giving insulin. Okay, this for another topic. If you want to discuss subcutaneous injection, put it on the comment section. Or if you have any suggestions on what we're going to discuss next week, please put it on the comment section. There you go. We're nearly done with our equipment. We're still on the equipment, but yeah, hopefully you're enjoying it. We're learning something, yeah? I hope you're enjoying it. Just don't forget to send hearts, yeah? And of course, click like this video. You'll see the gauze, not the sterile one. Yeah, it's just you don't need a sterile gauze during this scenario. What else? Are we going to use? Yes, of course, your injection swab. Alcohol swab rather. I think that's it. What else? So this one, remember I did mention about the insulin. So this is the insulin syringe you're gonna use on the examination, yeah. But let's save that for another topic, for another session rather. What else will you see? Of course, this one, water for injection. Okay, so during the examination, during the exam, the medication will be here, or this will be the medication. So the plastic ampule will be labeled as hydroxycobalamin 1 milligram per mil. Okay, so and then it says there, please treat this as glass ampule. Although there are reports from other candidates, they said, Emmer, actually during the examination, it's not the medication was not from a single ampule, it's from a vial. Okay, so some students, some nurses, they experience aspirating the medication from a vial instead of the plastic ampule. Okay, so so you might see this when I did my examination a couple of years ago. I did use this, yeah. The hydroxycobalamin, this is my medication. Okay, so they labeled this as hydroxycobalamin. What else? I think that's it. So those are the equipment that you will be using on the day. What else? I think there's something missing. The tray. Of course, you need the tray, yeah? Did we see the tray? I can't remember if we saw the tray earlier. So for the tray, of course, you have to make sure it's clean and ready to use. And more question, do we need to clean the tray? No need to clean the tray on the day of the exam, yeah? You will not be cleaning the tray on the day because the assessor will tell you, here, this is the tray, the blue tray, okay? The assessor will tell you that the tray is clean and it's ready to use. If that information is not given to you, just ask the assessor. Assessor, may I know if the tray is clean and ready to use? Okay, so again, you are not meant to clean it. And of course, the call bell, yeah? During the day of the examination, you will see an actual call bell. So I know during your practice, you're just imagining that this is the call bell, you're giving, so during your practice, you give the air. Yeah, so you touch the air. So this is the call bell. But on the actual exam, you will see an actual call bell. Okay, so please give the call bell to your patient. All right? Okay, so those are the equipment. If there's anything I missed, just of course, put it in the comment section. So, before we move on with the actual marking criteria, now we've done preparing the equipment, yeah? There's one more question. So earlier, I did ask you the question, what are the things we have to consider when preparing the articles or the equipment for the skill? You did mention about if it's clean, dry, intact. How about for the medication? Okay, so let's go back to the photo. So when you're preparing the medication, hydroxycobalamin, let's say hydroxycobalamin, what are the things you have to consider or you have to check before preparing it? Okay, for the actual medication, what are the things you have to consider or you have to check before giving it? Where's the medication? Okay, what are the things you have to check? Um, please write your answers on the comment section. Okay, when you're preparing your hydroxycobalamin, what are the things you have to check? Where is it? I can't find it. Okay, so let's see what are your answers. What are the things you have to consider or to check? Thank you for your answers. So I'm pertaining to the actual drug, yeah. So that the actual medication. When you're preparing that actual drug, what do you need to check or consider? And make sure before you actually prepare it. So then it said right drug, dose, of course, well done. Expiration date, Easter said. What else? Let me just show the marking criteria. Yeah. Just type your answer, yeah? What are the things that we have to consider or to check when we are preparing the drug? Okay, well done. Let's see. Let's hear your answer. So, Namrata said, she said no precipitation and discoloration. Well done. That's the answer I'm looking for. Yeah, no precipitation, no precipitating, no discoloration. If it's clear, there you go. If it's not cloudy, okay, of course the expiration date. Well done. We'll go to your answers, the rest of your answers in a minute. Yeah. So let's go back to the marking criteria. Thank you. So when you're preparing your vitamin B12, so make sure there's no precipitate, it's clear, it's not cloudy, no discoloration like what you've said, yeah? So well done. You're still awake. You're still awake. All right, let's go back to the marking criteria. So we've done. I mean, we've done discussing. We've completed discussing number one, of course, number two as well. So definitely remember this, guys. Yeah, for all the skills during the examination, if you're dealing with medication, it is important to check the patient's identity. Okay, remember this during the OSCE for any skill station, and when a medication is involved, such as IM, you have to check the patient's identity. Definitely, it is important. So You have to check the name, the date of birth, like what I mentioned earlier, probably the NHS number or the address if it's applicable, the allergies definitely, before you proceed. Okay, so you are demonstrating that you're checking the right person. Okay, so what else? You also need to check, of course, you will be given a prescription like what I've shown you earlier. So you have to read the prescription to make sure it's correct, complete, and it's due your time. So what are the things that you have to check? The drug, the actual drug, the dose, the date and the time of the administration, the route. Of course, it will be IM, okay? It will be just IM during the examination because, of course, it's the administration of intramuscular injection. And of course, any diluent if it's appropriate, but of course, you will not see any diluent because vitamin B12 is already in a liquid form, okay? And of course, the allergies. And of course, check the validity of the prescription. You have to read it. The signature of the prescriber should be there. So you might see the GP's name in there, the telephone number. You might see it. Of course, the prescription should be legible. Okay, the prescription should be legible. It says here, and if any of these pieces of information is missing, unclear, or illegible, the nurse should not proceed with administration of and should consult the prescriber. So that is unlikely. Okay, so remember this. That is unlikely. Why? Because of course you will not be able to perform your IM injection if anything is missing. So most likely the prescription will be correct and complete. Okay, but of course you have to read the entire prescription because if you don't read the entire prescription and you don't counter check it with your medication, that might result to a fail. Okay, so when you read the prescription, you compare the medication with the prescription. Okay, so that is important. So common fail for number 2, not checking the identity. Okay, it's a common fail during the examination. Another common fail for IM, not checking the allergy. Another common fail for IM, not reading the prescription and not interpreting the prescription properly. Okay, so those are the common fails for number 2 and number 3. So you have to make sure that you are reading the prescription carefully and properly during the day. All right. So if you have any question, please let me know. Next, what else written on the marking criteria? So going back to what I said earlier, so it's important to check the identity. Yeah. So for the skill station, which doesn't involve medication, let's give an example. CSU. What else? Removal of urinary catheter. If you check the marking criteria, checking the patient's identity is not required. Okay? So, most likely on the day of the examination, the assessor will tell you you don't have to do it. Okay? So, they might tell you that the checks or the ID checks have been completed. You may now proceed explaining the procedure and gathering your equipment. Okay? So, for all stations, it is important to explain the procedure and gain consent, definitely. Yeah, but checking the identity for stations is only appropriate for medication administration. So what are the stations which involves medication? IM, subcut, oxygen administration, suppository. What else? VIP, AIM. What else did I miss? So those are the stations which involve administration of medication. And of course, implementation station. It is important to check the patient's identity. For the rest, example, CSU, RUC, pain assessment, if you check the marking criteria, checking the patient's identity is not required. Okay, so for those people, who took the examination, they might tell you that actually the assessor told me on the day that I no longer need to check the patient's identity. Okay, so check the marking criteria. It's not actually written there. So just be careful with that. So I recommend when you do your practice both. Okay, so practice checking the identity, and of course make another practice wherein you no longer need to check the identity. Hopefully that is useful when you're practicing. So I know I always tell our students, if you're practicing for the OSCE, practice both. Okay, because you'll never know what the assessor might tell you during the examination. They might just tell you, no need to check the identity, just prepare the equipment and do the procedure. Yeah, so please do practice. But again, it is important for skills which involve administration of medication, it is important to check the identity. Okay, so hopefully that is a useful information. Number 4, of course, wash your hands. Do we need to demonstrate it? Of course, you know this. Make sure to follow the steps, the WHO guidelines when you're washing your hands. Of course, we have 5 moments of hand hygiene. Okay, remember your 5 moments of hand hygiene. So before and after touching the patient, before aseptic procedure, after touching the patient's surroundings, before any sterile procedure. What else am I missing? There you go. Comment on the chat box anything I missed. After touching bodily fluids, there you go, such as urine, blood, etc. Wound, definitely you have to wash your hands. So number 5, assemble the equipment required and prepares the medication using drawing up needle before replacing with either gauge 22, 21 rather, or 23 prior to administration. So, prepare the equipment. Um, of course, you might need to put your PPEs when you're preparing your medication. Of course, you'll never know. You might be allergic to the medication. Yeah, and of course, it could stain your clothes. Okay, or you might be allergic to the medication. Of course, you have to ensure that the medication is clean. So you have to perform aseptic non-touch technique when you are preparing your medication. So please do wear your PPE. It says here, use the drawing up needle or the aspirating needle when preparing the medication. Okay, but this is where a lot of people failed. Okay, when they revised this marking criteria. I know in our videos, in the old videos for IM, if you check, all the videos on YouTube, most of the videos there, we did a scooping method or like fishing method. So we basically did resheeting of the needle. Yeah. So when you prepare the medication, you don't have to resheet the medication. So you can just remove the aspirating needle and discard it directly to the sharps bin. That's why earlier I did ask you where you're going to discard the barrel and the needle. So again, I hope that's clear. Yeah, if it's not clear, please ask away or type it in the comment section. So after aspirating the medication, you have to remove the aspirating needle from the barrel of the syringe. You discard the needle directly to the sharps bin. And of course, you have to grab either gauge 23 or gauge 21 and put it and screw it on the barrel of the syringe prior to administering the medication. Is that clear? Yeah? So again, just to recap, after aspirating the medication, do not resheet the needle, yeah? Unscrew or remove the needle from the barrel of the syringe. Discard the needle directly to the sharps bin, and of course, screw gauge 21 or gauge 23 to the barrel. Okay, so again, a lot of people, I think the pass rate 2 months ago, it was, I don't know if I'm correct, Paul, if Paul is still here, it was like more than 30% because a lot of people unfortunately failed the IM. Okay, because of not following the marking criteria. So again, always remember before you go to examination, make sure to check the recent marking criteria because it always changes. And sometimes, or most of the time, there's no prior announcement that it will change. Okay, so you will just magically, the website will just update their marking criteria. Okay, so please do take note of that. Yeah, remember that. No need to resheet. Okay. So before administering the medication, what normally happens, the assessor will ask you to show them, the prepared medication just to make sure that you're actually administering the correct amount of medication, which is 1 milligram, okay, based on the BNF, okay, based on the BNF. Okay, so we don't know if it's 1 milligram in the examination. I'm just relying with the BNF. So I hope that's clear. Yeah. So when you're during the examination, normally before administering the actual medication, the assessor would ask you to show them the syringe. Okay, they will confirm if it's 1 milligram. Okay, so please do take note of that. They will give you instructions, don't worry. Okay, they will give you instructions. Number 7. Any questions? Hopefully that's clear. Yeah, if you have any questions, just type it on the chat box. Number 7. Assesses the injection site for signs of inflammation, edema, infection, and skin lesions. So, some candidates, they actually failed. Oh, we're still, I'm just checking the time. We will be ending soon, yeah? So I hope you're enjoying so far. You're not sleepy yet. We will go to bed soon. So, yeah, for number 7, take note of number 7. There is like a significant number of people who failed IM because of number 7. So make sure before administering the medication, you have to check the site, yeah? You have to state that you would check for any signs of inflammation, edema, infection, skin lesions, okay? You might also ask other questions such as check the patient if they had any surgery on that arm or they have fistula, okay? If you're not familiar with the fistula is what we use for when needling during dialysis, yeah? So that's our HD access. So that is your fistula. So again, state this question. This number 7. State this. You would check for any signs of inflammation, edema, infection, skin lesions. Okay, before administering the medication. Of course, you can add additional questions to ask, checking if they have any surgery, such as the same mastectomy. Of course, you cannot use. They will be nil by either arm. Okay, if they had mastectomy. And of course, fistula. Number 8. After, so clean hands again before you give the medication. So number 9 is you have to clean the injection site with a swab saturated with isopropyl alcohol 70% for 30 seconds. So allow to dry for 30 seconds. So the site, of course, you have to expose it. You have to clean it for 30 seconds. Okay. MR question. This is always the question for number 9. Do we actually need to wait for 30 seconds or what will happen? What do you think? So on the examination, you don't actually need to wait for 30 seconds. Yeah, just verbalize that you will, clean the site for 30 seconds. Normally, the assessor will tell you it's 30 seconds or it's clean. Yeah, so you can move on because if you're going to clean it for 30 seconds, you will be wasting 30 seconds of your how many minutes? So sorry, I forgot to mention this. IM, you will be given 12 minutes. Yeah, based on the current timings, it's 12 minutes. Yeah, but again, if you're watching this in the future, it may no longer be 12 minutes. Okay, so at the moment it's 12 minutes. So number 9, just verbalize that you're going to clean for 30 seconds. And normally the assessor will tell you it's 30 seconds is up. Okay? And allow it to dry for another 30 seconds. So MR, do I need to actually wait for 30 seconds during the examination? Once you mention it or once you stated that you're going to allow it to dry for 30 seconds, normally the assessor will tell you it's 30 seconds is up. Yeah? Because if you think about it, number 9, you have to wait for a total of 1 minute. Okay, you have to wait for a total of 1 minute. So that's minus 1 minute of your 12-hour already. So question, Corazon, she's asking, what is the proper way of cleaning the injection site? So what do we think? What is the proper way of cleaning the injection site? What is the proper way? Help me with this. We're going, we will be finishing soon, so hopefully you're enjoying it. So while waiting for your answers, so if you're new to my channel, we do live stream every Wednesday, 8 o'clock before we go to sleep, yeah? So it's 8 o'clock, so at least more people can join. Yeah, while waiting for your answers, again, please do subscribe and do follow me on my social media. Yeah, so hopefully you're enjoying this. Share this video and of course like this video. So what do we think? Yeah? What is the proper way of cleaning the injection site? We're nearly done. What is the correct way? Any answers from the crowd? What is the proper way? Corazon, what do you think is the answer? So you have different answers. Okay, you have different answers. So let's read some answers, yeah? Jeffrey said from center and then circular motion outward. From from where's my camera? From center outward. That's what Jeffrey said. Nene said up and down, side to side, or circular motion. Okay. Is it a rotating motion from inner to outer? You mean Corazon? Nin said up and down, side to side. So, what did we learn from school? From school, isn't it? From inner to outer. From inner, where's your camera? To outer. Yeah, circular motion. But to be honest, they're not really fuzzy in terms of how you clean it. Yeah, they're not very strict. As long as you clean it, yeah, as long as you disinfect it for 30 seconds, that's the most important thing. So, from inner to outer, if you want to do it like side to side, etc., that's fine. You will still pass, yeah? I never heard any feedback from the test center saying the candidate failed because she did not clean the site from inner to outer or from side to side or up and down, yeah? We never had that kind of feedback. To date, yeah, since I started teaching the OSCE since 20 something, we never had that feedback wherein the candidate failed because they cleaned the side, the site in a certain way, yeah? The most important thing is, as long as you're cleaning it, that should be fine, okay? But if you ask me personally, what do I suggest? I do agree with Jeffrey, yeah? So from the inner circular motion outer, yeah? If you're going to ask me, that's what I recommend, yeah? But again, it doesn't really matter as long as you're cleaning the site for 30 seconds, yeah? That's the most important thing. But we learned from school, probably from inner circular motion outwards. There you go. Well done. Yeah. So far, yeah, to date, we never had that feedback wherein the candidate failed because they cleaned the site differently. Okay, we never had that kind of feedback. Unless you're not telling me. Okay. All right. So on the comment section, if you failed because of that information, please do share it. Yeah. So we will learn. We all learn something new. Um. So yeah, that's number 9. So number 10. So number 10, guys, yeah, number 10 is crucial. So number 10 is what sets IM apart from subcutaneous injection. Okay, it says here you have to stretch the site. Why do we think we stretch the site? What's the reason behind it? Okay, that's my question. Why do we think we stretch the site? Are we not meant to pinch the site or whatever? What do you think is the rationale why we're actually stretching the site rather? What do you think? Have you ever thought about it? Why do we need to stretch it? So while waiting for your answers, guys, number 10 is crucial, yeah, because this is what differentiate from IM and subcut. So there's a significant number of people who failed IM because of not performing number 10. Okay. Hopefully I don't know if she's here. One of our students, she failed because of this. But she passed now. Yeah, she passed the examination. That's the feedback. The candidate did not stretch the site. So yeah, while waiting for your answer, what do you think is the rationale why we're actually stretching the site? Have you ever thought about it? No answers? Z-track technique to lock the medication according. But we're not doing Z-track technique here. It doesn't say Z-track. It just says here to stretch. The Z-track technique, of course, we do the Z-track to lock the medication. Well done. That's very good, Nanette. Yeah? But it says here to stretch the skin, okay? So that will be your assignment, everybody. Everybody watching now, I'll give you an assignment, yeah? For those 2 million watching us this evening and for staying, thank you. That will be your assignment, okay? So comment on the comment, write the answer on the comment section of this video. what's the reason why we are stretching the site? Okay, so what's the reason? That is your assignment. Okay. But yeah, thank you. So if you can still answer, write it on the comment section. That will be your assignment. All right. So number 10, a lot of people failed IM because of not stretching the site. So it is important you stretch the site before you give the medication. So Emmer, do we need to verbalize that? Yes, please. Yeah. Remember, stretching the site, it's a very minute, action. So the assessor might not be able to see you or might not see you doing it. So it is important when you're doing small actions during the examination, it is important you verbalize what you're doing. Yeah. It is important you verbalize what you're doing, especially number 10. Okay. There are a lot of people who failed IM because they did not stretch the site. According to them, Emmer, I actually stretch it. But again, I'm not there to prove that. Okay. I'm not there to prove that. So it is important to verbalize on the examination that you're actually stretching the site prior to administering the medication. Yeah. It is important. So IM, stretch, subcut, pinch if you're giving insulin. Again, if you're giving IM injection, stretch. For subcut, pinch if you're giving insulin. Yeah, pinch if you're giving insulin. So again, that will be another topic next time. So number 11. So what's the angle? 90 degrees. Okay, so when you're giving your IM injection, 90 degrees according to marking criteria. And so inject it until about 1 centimeter of the needle is left hanging. So that means you don't need to inject the entire needle. Yeah, so don't inject the entire needle. It says here until 1 centimeter left is hanging. But of course, you have to consider the build of the patient. Of course, definitely. If the patient is too thin, definitely, yeah, it depends. If you inject the needle, it might go to the bones. Yeah. So of course, that's why it is important at the very beginning, in real life. Yeah, in real life, when you're picking the needle for IM, of course, remember the lower the number, the bigger, the higher the number, the smaller. So of course, you have to consider that, or the patient's build when consider the patient's build when you're picking the needle size. Yeah, it says here until 1 centimeter is left hanging. Okay, so I can see your answers, but yep, I will put it on the comment section, and then we will verify it in the coming days. Yeah. So what's the reason why we are stretching the site? Go to Royal Marks, then you will see the answer. Next is, or if you Google it, yeah. Next is number 12. It says, so again, please do verbalize this, yeah, that you're going to inject the site for 90 degree angle until 1 centimeter is left hanging. Again, you have to say it because the assessor might not necessarily see what you're doing, because again, it's a very small action. Yeah. So make sure to verbalize that. I can see the right answer now on one of the comments, but yeah, let's wait for others to comment. But yeah, the answer is one of the answer is correct. Next is number 12. So depress the plunger at approximately 1 ml every 10 seconds. So how much medication we're actually giving? So we're giving 1 ml. So the prescription is, the preparation of the medication is 1 milligram per ml. So if you're giving 1 milligram, so the total amount of the medication you're going to administer is only 1 ml, which means you're going to administer the medication for 10 seconds. So you have to count. Yeah. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then what's next? Number 13, you have to wait for 10 seconds before withdrawing the needle. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 before withdrawing the needle. Okay, so that's number 12 and number 11. That's the marking criteria. It says here, only if you're giving the medication using dorsogluteal muscle, you have to pull the plunger back, or you have to aspirate and check if you hit any vein, etc. Okay, so if you're most likely you will be administering the medication here, okay, on the patient's arms. Yeah. So you don't need to pull the plunger back. Okay, so dorsogluteal, of course, the buttocks. If you're going to administer the medication there, which is unlikely on the examination, that's the only time you're going to pull the plunger back. So that is one of the evidence-based practice. Okay, so one of the evidence-based practice in the UK, you don't need to pull the plunger back if you're giving the medication um, the rest of the body, except dorsogluteal muscle, based on the marking criteria. All right, we are nearly done. Number 14 says here, withdraws the needle rapidly, of course, after waiting for 10 seconds. Apply gentle pressure to any bleeding points, but does not massage the site. Again, please do not massage the site. You apply only gentle pressure. So probably you can put a gauze here in between your fingers. So before pulling the needle, apply the gentle pressure and then pull the needle. Because of course, can you imagine if you're pulling the IM, yeah, sometimes the skin will go with the needle, so it's kind of painful. So pull the plunger back, pull the needle, and then apply gentle pressure. Do not massage, yeah. And then number 15, you apply the plaster. Yeah, you apply the plaster. Number 16, you have to ensure that all sharps and non-sharps waste are disposed of safely and in accordance with local approved procedure. So we've discussed that already. So again, please take note of your clinical waste bin, of your black bin, of your sharps bin. Okay, so definitely the needle will go to the sharps, yeah? We discussed that earlier. And number 17, of course, after giving it, remove your PPE, wash your hands, definitely. Remember, 5 moments of hand hygiene after um, um, of course, after touching the patient's surroundings, after touching the patient, definitely, and of course, after contact with bodily fluid, because of course, when you're giving IM, definitely there's blood. Okay, so definitely you have to wash your hands. And last but not the least, ano, penultimate criteria, you have to, of course, sign the drug chart. Definitely you have to put your name, your signature, the date and time if it's required. And of course, you have to act professionally throughout the procedure. Okay, so that's all the marking criteria for tonight. To summarize, okay, the common mistakes for IM. Okay, these are the common mistakes for IM, yeah? Let's go to the criteria again. So, common mistakes for IM, which page is 25? I hope you're still awake, yeah? I hope you're still awake. We still have 2 million. So, guys, please do like this video and then please do subscribe, yeah? Um, so, to end our night, what are the common mistakes for IM? So, number 1, not checking the patient correctly, the patient's identity. So, it is important to check the patient's name, date of birth, and of course the allergy. Make sure, the second tip is make sure to check if you have an ID band, check the ID band with your document. So Emmer, what if you said earlier, you mentioned earlier is in the community? Of course, just simply state that you have the correct patient, yeah? That it matches your record. Because remember, whenever the patient tells you the information, you have to counter check your drug chart. Yeah, so when the patient tells you, my name is Emer Diego, you look at your drug chart, and once they've mentioned all the information, you have to confirm that you have the correct patient. Okay? So that's your number second criteria. For number 3 and number 4, make sure you read the entire prescription and make sure to identify that the prescription is correct, complete, and is through your time. Yeah? Make sure all the components of the correct prescription is there. What are those? The medication, the date and the time, the prescriber, etc. Okay? So, I hope you remember all the information about the vitamin B12. So at least now we know what the indication for the vitamin B12. So you at least remember that. The usual dose for vitamin B12. That's hopefully that's useful. And also our side effects. You might need to tell the patient what the side effects are. Okay? It's not necessary, but of course it is important to educate the patient about the medication what you're about to give. What else? Not cleaning the hands, okay, when it's necessary. Okay, again, don't wash your hands 100 times. Okay, wash your hands when it's necessary. That's the most important thing. Next, another common mistake here is, of course, number 7. Okay, number 7, don't forget to assess the injection site before giving the medication. And of course, I forgot number 5. Make sure, do not resheet the needle. Okay, do not resheet the needle. You have to discard the needle straight to the sharps bin. Okay, because again, a lot of people failed this section of the exam last month. Okay, or last month, when it was um when the marking criteria changed. What else? And of course, not not proper technique yan, not giving the medication using, I mean, giving the medication, not following the proper technique. Of course, um, um, inject it 90 degrees, stretch the site, give it for 10 seconds, wait for another 10 seconds, and then of course withdraw rapidly. Do not massage the site. Okay, so of course important, and of course your documentation. Okay. Any question for IM? I hope you enjoy it. So let's do some couple of more, one or 2 minutes for your any questions. Any questions? I hope you learned something tonight. Um, Thank you for spending the night with me. Yeah. Okay. I know you're probably tired and sleepy now. Um, just type in the comment section. If you have any questions, or type in the comment section when is your exam. Okay, when your exam is, and where you're going to take the exams. Yeah, who's taking the exam in Oxford, who's taking the examination in Leeds, Ulster, Northumbria, or Northampton. Okay, so before we end the night, so good luck, everybody who's taking the examination very soon. I hope you enjoyed our session. Okay, any questions before we end the night? I know the stream is delayed because, yep, any questions before we close the stream? No more questions? Nin said, I understand properly. My exam is December 7th. Oh, okay. You still have more than a month, Nin. So well done. Easter, did you manage to book your exam? Northampton. Okay, so good luck, Easter. Nanette, well done. So, guys, we will do another live stream next week, yeah? So, um, of course, comment on my channel which topic do you want to discuss next. And of course, please do share this video if you enjoyed it, okay? So, see you on the next one. Good night, everybody. Okay, good night. It's time to go home now. Right? See you next week. Bye bye.